hello. We're going to get started here, and it's a good presentation and not a good presentation because the reason that we are talking about this is because our country's in an opioid crisis. But we're going to turn it into a positive in that there is funding available to address behavioral health, substance use disorder, and other health related and community development needs as a result of this. My name's Elizabeth Burrows with Burrows Consulting, and Callie Rockwell's with our team as well. So she'll be manning the chat. And also, if you have questions, feel free to email those to her or put them in the chat and we'll get those addressed. And this is Madison from my team. And I will tell you, Madison's, I think, been our superstar in writing opioid funding settlement dollars and has some stories to share, which I know is what all of you want to hear about, right? What's been successful and what hasn't. So today we're going to focus on why opioid settlement funding matters. And just so you understand, this is where the attorney generals of, I think, all 50 states, or it's in process for all 50 states, have sued the Sackler family and that as a result of the opioid crisis. This is the settlements that each state received. Every state has done this differently and how they handle it. We're going to address that a bit today, but we'll talk more about that. But again, it is almost like herding cats to figure out how each state is divvying this out. It is up to the state, and in some states it's the attorney general, and in some states it's the health department or social service agency. And then we're going to talk about some upcoming and current opportunities, such as the Kentucky opportunity that's open right now. I'm going to turn it over to Madison now to share the real stories that we all want to hear.
All right, thanks, Elizabeth. Hi, everyone. I'm Madison. I'm a grants coordinator here at Burrows. And like Elizabeth said, I have worked on some of these opioid settlement grants, and I do enjoy working with clients on these. We do have a decent track record of success guiding our clients to secure these funds. Here's a kind of a list of some notable achievements. Some I've personally worked on, some I have not. I know that sometimes whenever you see an opportunity, of course you want to go after it. You have a patient base that needs these services and you want to provide these services, but sometimes it's not always easy to know, well, what exactly should I ask for and how should I form a program out of this so that it's grant fundable and makes sense. So just to kind of give you some examples of some things that have been successful that we've done, I'll kind of run through these and then also kind of refer back to them throughout the presentation. So Genesis in Florida, this was one I worked on. She had won a behavioral health grant earlier in the year. And so she kind of had an established behavioral health primary care integrated service line, but they really needed to formalize this and really kind of streamline their systems to further integrate care. So we did something called SBIRT, which stands for Screening, Brief Intervention, and Referral to Treatment, which is essentially an evidence-based practice that integrates substance use disorder, behavioral health, primary care. So they hired a psychiatric mental health nurse practitioner to kind of take the lead on this and make sure that all providers, both primary care and behavioral health, were trained at their health center on these processes. And then another big focus of this grant is it was actually a county level. So they wanted one or two organizations to kind of take the lead on this programming in the county. So Genesis hired their staff, their nurse practitioner, to also do SBIRT training in other partner organizations. So partnerships were also a big deal in this application. And then another one, Life Point in Idaho, different area of the country out west. They were very rural. They were our medical center and had an existing emergency department. And they had kind of some existing SUD treatment, and they had an existing partner organization that they would send, their overdose or substance use patients to. But again, it kind of needed to be more streamlined. So they had a lot of overdoses coming into the emergency department. But then what do you do with those patients after? So they really wanted to do more of a full spectrum offering of care. and kind of use this existing partner that they had. So they funded the actual medicine to provide substance use disorder treatment in that emergency department on the spot. And then they also hired staff to just kind of manage this program, the emergency department, including a care coordinator and also a recovery navigator to make sure that these patients were connected with a recovery center. You'll see that care coordination, continuity of care is a common theme that comes up a lot in these applications.
And I
Um,
just want to add some of these were FQHCs, some are CCBHCs, some have multiple status FQ, CC, BHC, CMHC, some are hospitals. So again, the examples we have our healthcare organizations, social service agencies can also get them as well. But again, usually our focus is always healthcare organizations and direct care providers. So I just wanted to add that in. You're seeing kind of a mix of those.
yes, very true. And a lot of those organizations will serve kind of a similar patient base and kind of have similar needs, but there are some definite nuances in kind of where you're starting. And then Fresh Start in Kentucky, they actually didn't reinvent the wheel completely. They had existing substance use disorder programming. They were serving opioid use disorder patients. But the need was so great in this rural community that they needed to enhance this program more. So they hired additional psychiatric mental health nurse practitioner and a clinical social worker. And the big thing is they were able to highlight the need and say with quantitative and qualitative data to say, look, there's still a gap in services. We still need to see more patients through the door without kind of creating a whole new program.
And they also were an STI clinic. So even, again, there's another example of different types of entities getting the funding.
Mhm, exactly. Brownsville in Texas, I love this program. A colleague wrote it, and I think she did a great job on this proposal. They also had one behavioral health expansion grant, so they kind of had the groundwork set for this kind of integrated programming, and were really already doing medication assisted treatment, substance use disorder, opioid use disorder treatment. And they had these great services in a very high need area of the country, but the community wasn't totally aware of these services. So they took this opioid money and they really focused on community education and awareness. They hired bilingual community health workers, and they also put some money aside for a public awareness campaign to work with a local news department to do English and Spanish commercials, and then also did some social media stuff with Google Ads and Facebook ads. So their main goal was to get new patients in the door. And that was a good way of doing that. And really just normalizing to the community what is normal and what is not when it comes to substance use disorder and how to seek help. And then another Texas program that I did personally work on in a urban community in Texas. This was one that they didn't have an existing robust substance use disorder program, but they're a huge health center. They see a lot of patients and they have a huge population that needs these services. Um, so the biggest thing that stood out to me whenever we met with the behavioral health director was she gave a story of a homeless man walked into the health center one day and he clearly showed signs of mental distress, substance abuse, and there wasn't kind of a clear-cut plan for how to handle a person with this high of need. And because they were going to need a lot of resources, a lot of connection with different community partners. So they focused on a warm handoffs program, and the goal was really to make sure that they could support any patient from start to finish on both ends of the spectrum, meaning they partnered with transitional housing facilities so that they could go on site and meet people where they're at, get them into the health center, and then also at the end of the spectrum, if they needed services that were outside of the scope of HHM Health, then they had those partnerships and warm handoffs in place so that they could send a patient on to substance use disorder inpatient treatment or a recovery facility, for example. So those are kind of a high level overview of kind of what we've done and what's been successful. And I think there's some good kind of different stories and how you can kind of take stock of what you already have and really use an identified need in the community at your organization and try to create a fundable program from there. Next slide.
So again, looking at the bigger picture, there's 50 plus billion dollars in opioid settlement coming out through 2038. So I've had a couple people tell me, well, my state's only giving out like 100 or 150,000 at a time. I don't know if it's worth it. That could very well be renewable through 2038. So you start counting, we're in 2025. I start getting my calculator out, and many of you know this is my secret pink grant calculator. I start doing 13 times 150,000. We're getting up to something that you may not want to miss out on. Okay. Plus, these allow you to bill for them. So each of the client success stories that we've talked about, those are people that are going to be billing for those services. So that's additional revenue. Please note every state has their own processes and timeline. So it is what it is. In the state of Indiana, ours goes through our counties. So county commissioners hold the power, and it's that way in some states. In Kentucky, in Texas, in Florida, it's statewide RFPs. Again, it is different in each and every state. Some of them are state RFPs, some are regional, some are county, some are automatic, some are running through the health department. I've heard another client call us, and actually, this wasn't any of our success stories. This is separate, but they actually partnered with the county health department, so they were getting part of that money to be able to implement that. So the county health department was almost a pass through. So if you look up the success story, you would see that it didn't even go to our client. It went to the county health department, but that hospital was actually benefiting and getting money. So start thinking outside the box, think who you know. It's also been going through some economic development organizations in cooperation with counties and regions. Prevention, treatment, recovery. Those are the three things always to think about. Okay. As you could see, you might say, well, all your projects were totally different. They all dealt with those three things. The other thing, if you want to know a super secret thing, we're not putting on the slides, so you can't see it on the slides, but here's your free bit of information. If you're listening to it on our YouTube page or you're on live, evidence-based practices. You know, Madison referenced expert, using prepare tools, other things. Use those evidence-based practices that work. And health centers, we don't provide SUD treatment. Do we fit? Yes, you are still helping address the epidemic in some way. Hospitals, do you fit? Yes. You tell me a hospital ER director that hasn't seen the opioid epidemic walk through their ER. There is not a ER in this country that can't say that. So again, we are all addressing it, whether we admit that or not. So figure out ways that you can do that. And again, we've told you examples, STI clinics, or Ryan White lookalikes, as you want to call them, FQHCs, hospitals. But again, we also have had free clinics come to us, social service agencies. You know, consider what you're doing. Are you helping address this epidemic? Yes, you do qualify. And again, every state is impacted in some form or fashion. Yes, there are focuses along Appalachia. Also, extra information if you want ideas and you say, I don't even know how to start, I encourage you to read Beth Macy's book, Dope Sick, and the sequel. Actually, one of my friends is featured in that book. It's very close to my heart. Or watch Dope Sick if you say, I'm not a reader. I'm a reader and a watcher, but if you want to watch either of those, there are ideas for how you can help address the opioid epidemic. So, again, I've listened to Beth Macy's book twice. It's amazing. So, please consider that if you say, I don't have any ideas. Or you can always reach out to Madison, Callie, or me, and we have about 100 ideas for how you can address this.
All right.
Okay, go ahead, Madison. Sorry.
Okay. Yeah, okay. As some of you may or may not know, Kentucky recently released its NOFO, Notice of Funding Opportunity, and application for the state's opioid settlement funding. It opened the 15th of October and it will close December 19th, which may seem like a long time away, but it's actually not. Whenever you start kind of looking at these applications.
And
And
remember, you might need partnerships. So get started now because we lose a week at Thanksgiving, at Christmas, schools are shutting down. If you need universities, get started now on this. Sorry.
exactly. And some of these programs are partnership heavy and they may kind of impact where your program design leads. And you might need an official memorandum of understanding or letters of support. So always good to kind of get that going as soon as possible. Um, and then for the Kentucky one, it's through the Kentucky Office, Advisory Council, which most states have something similar to this that they just manage the funds. And then according to these NOFOs, the award amount is 1 million for 12 to 24 months. You have the option to choose that timeline and budgetary needs. They actually released two separate NOFOs, Notice of Funding Opportunities, one focused on treatment and recovery priorities, and then one focused on prevention. So it is allowable to apply for both of these if your organization does both and has the capacity to do two applications. They do just want them to be very different projects. Another reason to start early if that's something you're considering. For the treatment and recovery priorities, medication assisted treatment, housing is big, peer support, care coordination, definitely a hot topic, and also family supports. And for prevention, a bit more straightforward, a big focus on youth programs, addressing adverse childhood experiences, parent and adult education, and also naloxone distribution. For both of these, they are restricting, they're saying no land purchases, construction, or vehicle acquisition. So this is not the opportunity to, for, a capital project or any sort of mobile unit or anything like that. Um, and then we have had previous success in Kentucky with Fresh Start. And this was the one that they took stock of their existing programming and realized that they needed more substance use disorder focused staff. And that was kind of the focus of their project. And if you have any questions about that opportunity, we can also address those at the end.
And here's other opportunities on the horizon. One, Ohio Foundation has been giving out a lot of money. Again, statewide RFP, regional grant cycle we're expecting in December of 2025, and funding opportunities open in January. Again, there's a lot of unknowns going on at state and federal government. So again, keep that in mind, but these are just things we're trying to give you a heads up. North Carolina has an RFA out, which is RFP, which is a NOFO, which is all the same things, which means you can apply for money. Okay. We don't care what the acronym is. It means money is out there. Awards up to $500,000 due November 3rd. If you would like us to help out, please reach out today because we would need to get going ASAP on that. But 500,000, that's a very significant award. There are additional state and foundation opportunities. If you are not signed up for our newsletter, you should be by registering for this Zoom. But if you are not and you're watching this on our YouTube page, please reach out and email us because we do put these opportunities out in our newsletters that go out on the 1st and 15th of every month. Also, know there are states and counties that are only sending these to the CEO of healthcare organizations or social service agencies. So you may say, well, I'm already the head grant writer at this hospital, so I'll be informed of it. Make sure your CEO knows there are sometimes they only go to the CEO. So to be watching for it. Okay. The other thing we just found out today, a couple of these went to CEOs' spam folders or trash folders or whatever we want to call them. What do they call it? The COVID folder or whatever, where it's like we don't know if it's a good email or not coming from a state mass email. So please watch for that because we have had people, and I think Madison can attest. I know a couple of our teammates could tell her anyway stories where literally we found out about it like 2 days before it was due. I guarantee that entity or even us as Magic Grant Writers, we can only do so much with 2 days. So again, make sure your CEOs are watching for this because sometimes it does only go to one person in the organization. But again, there are opportunities on the horizon. And again, every state's going to be having that. So watch for it.
Okay, so kind of going back to some of those success stories and previous applications that we had worked on, and some common themes that we've kind of picked up on, and things to be thinking about if you're thinking of applying for opioid funding. Partnerships is going to make your application more competitive. And kind of the levels of partnerships may vary. They may be a very invested partner, or they may just be, someone that's kind of in support that you're going to coordinate referrals with. It all comes back to care coordination and continuity of care to really make sure we're caring for the whole patient for most of these healthcare organizations. Um, because not every organization can maybe necessarily provide prevention and education through to treatment. So you don't have to, as long as you have, partnerships in place to show that you can support those patients. Data collection from day one will strengthen evaluation and reporting. And two things kind of come to mind with this. So for opioid funding, for opioid statistics, as far as, overdose, substance use disorder rates, this is kind of all over the place for different states. Some states have a really great, beautiful, dashboard with all these statistics, and some hardly track it. So I think if you have community health needs assessments, or if you can kind of start thinking, what's going on actually in my local community, and what will I have to go off of in order to kind of showcase the need? And pretty much any grant application is going to have to talk about a needs narrative or a needs statement. And then also another thing with data collection, in any grant application, there will be goals, outcomes, objectives, and they will need to be reported on. So if you just start thinking early, do we have the capacity? Do we have the systems in place? What are we currently measuring? What do we want to measure? That will kind of guide you in your program planning as well. Sustainability, also kind of two things come to mind. But obviously, any funder wants to know that this investment, the government is a funder as well. They want to know that this investment will last, that impact will continue beyond the 1 or 2 years of your program. So many people may think, well, financial sustainability. Yes, that is very important. If you hire, a high paid position, how are we going to fund that once the grant is over? But also when it comes to sustainability, weaving it into every aspect of your proposal from the beginning. What is reasonable in this allotted time frame? Setting up systems from the start with reporting and staff training, just showing that you have thought through this and have plans for after funding ends. Same thing, health centers can build on existing services instead of starting from scratch. This is very true, alluding to what we talked about earlier, just taking stock of kind of what you already have and identifying that need, using grant funding to fill that need, and building on what you have existing instead of reinventing the wheel. Next slide.
All right. And again, why work with us if you do need help on this? We've done this for a long time. I've been writing grants for 25 years. I think if you add all my team and years of grant experience, it's over 100 years. So we've been doing this for a long while. We just reached our $500 million, so over 505 million secured for our clients and communities. And even more importantly, almost 5 million secured from opioid settlement dollars within the past year. And again, we know all this stuff, strategy, storytelling, compliance, and reporting, and we can even help you on all that. I have people who say, well, I don't want to deal with a grant because it's too much reporting. I heard that very thing this week, okay, from an FQHC in Nebraska. And this is what I said, we can help you on all that. And again, this is amazing opportunity. We all know somebody. It's just like we all know somebody impacted by cancer. We all know somebody that has been impacted by the opioid epidemic in some form or fashion. We all have a story we could tell. Unfortunately, we wish we didn't, but we all have a story that we can tell. And how important this money is to getting and addressing the opioid crisis at the federal level, at your state, county, and community level, and getting people the behavioral health resources, the healthcare resources that they need, that they deserve, and hopefully that they can get at reduced rates that everyone has access to that care. And I think next you guys can feel free to reach out to us. So again, next steps, start looking. We can go back to the next step. Sorry. We start looking here, think of projects, we gave you some great ideas. Look at your own, talk to your providers, what's really needed. I guarantee they're going to have stories, just like we had the story of the house person walking in the clinic and what they need. When you talk to the people, the MAs, the nurses, anyone at your facility, the behavioral health providers, they're going to have stories about that. Think of partners and MOU. Start talking to people now. Don't wait until the notice comes out. I mean, right, we're already ticking down days with in October for Kentucky's, and we know Ohio's is coming out. So don't think, well, I've got time. Start getting that together. Start looking at outcomes and budgets. And again, we're here to help if there's anything that we can do to assist you. And also let me know if this webinar helped you. I get so excited when I go to conferences and I hear, hey, we saw a grant in your newsletter, we wrote it ourselves and we got it, or this helped assist us. We love hearing that. Callie and I do a lot of work to get information out for people, and we love hearing your success stories as well as the success stories that we can assist you with. And if you just say, I don't even know how my state's going about doing this funding, reach out to us as well, and we'll try to untangle the web of how to find out how to do it in your state as well. Feel free to reach out to Madison or myself or Callie, and we're going to open it up for questions. We may not have all the answers because there's a lot to this funding, and everybody's doing it so differently, but we're going to do our best. So if you're on live, feel free to unmute and ask a question, or if Callie's had some come through the chat or in advance, we'll answer those as well.
Yeah, I have one of the questions that came through was just some more examples of partnerships.
Yeah. Well, I'll let Madison jump into a couple that I know I've seen. Definitely always the healthcare providers being partners, but schools can be amazing partners because of the impacts that they're seeing, either directly or indirectly. We've also seen some great partnerships, again, social service agencies, your community action programs, your local chambers of commerce. That's the other thing sometimes we don't think about in healthcare. We think, oh, well, the healthcare industry's been impacted. Also, the workforce industry has been impacted a lot through the opioid settlement. So thinking of that, your chamber, local employers that have had to spend a lot more money. I've read statistics on that and how much the opioid crisis has impacted employers. So those are some other good partners. And also just your community, looking at your community. In every community, it's different. In some community, the Lions Club is a leader. In some communities, it's the Kiwanis Club. In some, it's some locally started organization that gets things moving and shaking. So we all know those people, but I think getting the community leaders, the community catalysts for making a difference, I think getting them involved is also key. Madison, do you have anything to add?
I would also just tag on to that, maybe law enforcement agencies or the criminal justice system, because they are very much intertwined with the opioid epidemic as well.
I believe we have a client who's partners with the fire station.
Yeah.
Yeah. Margaret?
I have a question. Thank you, by the way. I appreciate you sharing your expertise on this. I work with one organization that does mental health, and I just wondered if you have any experience. Like, they're on they're on the prevention side. They do peer groups where they're helping people with addiction and trauma. And so I'm sort of looking at North Carolina, going, we need some strong partnerships. We may have some, I just have to think about if they'd be competitive enough. So I just wondered, like, sometimes the prevention doesn't seem like it's high of a priority, and the mental health piece, I just want to see if you have any thoughts about that.
Well, again, I don't know all the ins and outs of your organization, but I would encourage you to try to get a partner and try to apply right now because the money is available in North Carolina. And sometimes even if you get turned down once, you get your name in there. You
Yeah,
know,
right.
sometimes they need to see there's a lot of foundation grants. We tell
Yep.
people sometimes you've got to have your name in there 2 or 3 times, so they see that you're serious. So I might consider that.
Or you can get some feedback for next year, like, hey, this wasn't strong, right? Yes. Okay.
So, some people will say, I had somebody, we had a client recently, they got turned down from one of the largest foundations in the country, but they said they want to come out and visit. I don't even think it's worth their visit. Do you? Oh my, I said that is a huge win. They want to come tour your facility. Heck yes, get them out. That means next year you're going to be a competitor. So
Good.
you roll out the red carpet for these people. And because this was a multi seven-figure grant that they had applied for and not gotten, but they wanted to come visit. And I said, that is huge. So to me, that was a big win. To the client, well, they got turned down for their money, but they are having them come out, and I will probably bet on a win next year. So again, and consider, look at your partners. Is there a hospital, an FQHC that can do the treatment and or community mental health center, CCBHC? I know North Carolina has a lot of CCBHCs. Look at that. And maybe you could do both pieces because again, we have our providers are saying sometimes the prevention is the hard part. So I
Oh,
think you
okay.
could be a perfect puzzle piece to that as well.
Thank you.
Mhm.
Appreciate it.
Any other questions from our attendees or from people outside? All right, well, we'll give you some time in your day back. We want to thank you. I know time is super precious, so thank you for giving us a little bit of your time. And we wish you the best of luck in attaining money for your organization and your community in addressing this very serious crisis. And again, if you're on the fence, please go after the money because, again, somebody needs to go after it. And I guarantee someone you're working with is going to be doing great work. So please encourage them to apply.